The ASHP Foundation, dedicated to improving the health and well-being of patients and health systems through appropriate, safe, and effective medication use, and the Cardinal Health Foundation, making a meaningful difference in the health of communities around the world, are joining to honor the Houston Methodist Hospital System with the 2015 Award for Excellence in Medication Use Safety. In 2012, Houston Methodist convened an interdisciplinary team to lower the incidence of delirium among its acute care geriatric patients. Nationwide, delirium complicates hospital stays for more than 2 million elderly patients each year, adds a 10% risk of mortality to a hospital stay, and can cost as much as $64,000 per patient.
Prevention is the key to delirium. Once we have it, then we just have to search for underlying causes.
At the time of the project's launch, evidence pointed to frequently prescribed medications as potential causes of delirium in the elderly.
The incidence of delirium, I think, in the literature is around 40%. We were no different in some of our exposure of medications that are at risk for that population, and it was very eye-opening.
The pharmacists on the team dug deeper into the use of these medications to help shape the project and define its outcomes.
We wanted to uncover where those medications originated in their prescribing, because then we thought we could address their utilization from the point of prescribing all the way through the patient's hospitalization.
The data showed that the majority of these drugs were initiated by prescribers through pre-existing order sets. Armed with this knowledge, the pharmacy team designed a system that created an alert when problematic drugs were prescribed. When the pharmacist received the alert, they would schedule a follow-up conversation with the prescribing physician. During these follow-up conversations, pharmacists recommended to prescribers alternate, safer medications or reduced doses of the prescribed medications.
The ability to put that all into a program, the ability to actually change the orders, the ability to actually change the therapy with the consent of the physicians taking care of the patients through the pharmacy is what made the biggest difference in our program.
The pharmacy management team has always operated under the notion that pharmacists are leaders.
The program also trained future pharmacy leaders with resident pharmacists in key roles on the team.
And for them to allow a pharmacy resident to take up that opportunity really speaks to the fact that they see the growth or the potential for the future of pharmacy. And for me personally, this was a new, exciting opportunity to learn something I had never done before.
As part of the delirium prevention program, nurses are trained to conduct frontline screening of at-risk patients twice a day and may initiate a pharmacy consult to review medication orders and medication history. Likewise, patients are monitored during discharge. Since implementation of the program, over 22,000 patient encounters have been electronically monitored, generating 7,400 medication safety alerts that resulted in approximately 2,000 pharmacist interventions. Following implementation of key strategies, zolpidem and diphenhydramine use have decreased by over 40% from baseline. More than 100 order sets have been changed. There has been a notable decline in hospital-acquired delirium.
Our goal was to make these patients safer while reducing the overall cost of care. Your drug may have been more expensive, but if the overall cost of care, they didn't stay here for 2 weeks, then it doesn't matter that the drug's more expensive. Their goal on total cost of care was achieved, and then some.
We really are focused on a value equation here of saying how can we best provide unparalleled safety, quality, service, and innovation, and do so at the most efficient cost. And this project really hit a grand slam home run on all of those factors.
How are you feeling? Quite well, thank you. Wonderful. I'm here.
For its groundbreaking work in mitigating the incidence of hospital-acquired delirium in the geriatric population, the staff of the Houston Methodist Hospital System is honored with the 2015 Award for Excellence in Medication Use Safety.